Alright, we have a challenging case on our hands.
Mastitis and transient synovitis. What do you think could be the diagnosis?
Burkitt's disease is more common in certain populations, but the combination of symptoms is puzzling. It could be an autoimmune reaction, maybe lupus.
Mastitis is a breast infection, but combined with the other symptoms, I'm thinking it might be some sort of genetic disorder affecting multiple systems.
Transient synovitis usually affects children and is related to joint pain. But I agree with Kelly, the combination of symptoms is pointing towards something genetic.
You're all wrong. This is a case of adenylosuccinate lyase deficiency. It's a rare metabolic disorder that affects brain development. The patient needs immediate treatment.
Adenylosuccinate lyase deficiency? That's a rare disorder. How did you come to that conclusion, Hawks?
Trust me, I've seen enough in my years of practice. We need to perform an esophagectomy. It's risky, but it's the only way to save the patient. Tracy, I believe we need to perform an esophagectomy on my patient. They show signs of adenylosuccinate lyase deficiency, and it's the best course of action.
Hawks, are you sure about this? Have you considered all other options?
I know what I'm doing, Tracy. I've seen this before, and I know what needs to be done.
I understand your confidence, but we need to be cautious. Let's explore all possibilities before proceeding with such a risky procedure.
You're questioning my experience, Tracy. I've been in this field for years, and I know what is best for my patient. Trust me on this.
It's not about questioning your experience, Hawks. It's about making sure we do what's best for the patient. Let's discuss this further before making any final decisions.
Oh no, the patient is in critical condition. This wasn't supposed to happen. I need to tell Hawks the truth. The esophagectomy was not the right treatment for adenylosuccinate lyase deficiency.
You imbeciles. How could you have chosen the wrong esophagectomy? And on top of that, the wrong diagnosis. You nearly killed our patient.
I was sure it was a case of esophageal cancer. It seemed like the right call at the time.
But the symptoms were pointing towards a severe case of GERD. I stand by my diagnosis.
I thought it was a rare case of achalasia. I still believe that was the correct path to take.
Wrong, wrong, wrong. You're all wrong. You're all a disgrace to this profession. I can't believe this incompetence. I'm out of here.
But, Dr. Hawks...
Shut it, Gary. Figure it out yourselves. I need a drink after dealing with your incompetence. I can't believe I still haven't figured out what's wrong with Mr. Smith.
Maybe you should try looking at his symptoms from a different angle. Have you considered a rare genetic disorder?
I did, but his test results came back negative for any genetic abnormalities.
What about an environmental factor? Could something at home be triggering his condition?
I thought about that too, but his family history and living situation don't seem to be the cause.
Well, maybe it's a combination of factors then. You know, sometimes it's not just one thing.
Wait a minute. I think I know what it is. His symptoms match up with a rare autoimmune disorder I studied back in med school.
Seriously? What is it?
I'll have to run some more tests to confirm, but I think I finally cracked it.
Sorry, Johnson. I gotta go check on this right away.
Wait, you're just leaving me hanging like that? No goodbye or anything?
I'll make it up to you later, promise. Thanks for the suggestions, Johnson. I know I don't have the proper gear, but we have a life to save here.
Hawks, this is unacceptable. You can't just barge in like this.
We need to follow protocol, Hawks. Lives are at stake.
What are you thinking, Hawks? This is reckless.
I don't care what you think. I found the real diagnosis. Adenylosuccinate lyase deficiency. Trust me on this? Tracy, I knew from the beginning that my diagnosis was correct. If you had just listened to me, we could have avoided this whole mess.
Hawks, the wrong diagnosis almost cost that patient their life. You can't just jump to conclusions without considering all the possibilities.
I did consider all the possibilities. I just knew my gut feeling was right.
Your gut feeling almost killed someone, Hawks. You need to trust the process and not just your instincts.
I'm not the one who ignored protocol, Hawks. You need to learn to work within the system.
The system failed this patient, Tracy, and you failed me by not trusting my expertise.